Good morning. I am Dr. Chaudhari Mahesh, Senior Consultant Neurosurgeon at SL Raheja Hospital. I have been a neurosurgeon since 1982 and practicing since then. Been to the university, Health University as a teacher, and so many neurosurgeons have studied under our guidance. Today, I thought we'll select a little different topic, but equally important and also quite close to the neurosurgeons all over the world, that is spine. Now, spinal lesions can be divided into multiple categories. So far as the neurosurgeon is concerned, neurosurgeon is always keen to do all spinal cord tumor surgeries. And in fact, he is trained all throughout his curriculum for the same. Along with this, we are also involved in treating certain degenerative disorders as well as certain congenital anomalies, that is the birth defects. Now, how a spinal lesion presents? Now, normally the spinal lesions present with symptoms or signs related to the spinal cord, the nerves originating from the spinal cord, and the muscles supplied by the spinal cord. So, in short, we can have neck pain, dorsal spinal pain, lumbar spinal pain, or sometimes the pain radiates all along the body vertically downwards or in a particular limb along its dermatome. That is the part supplied by a particular nerve. Occasionally, you might find this presenting as a numbness, tingling, or once in a while, you'll get a complete loss of sensations. You must be aware that bladder and bowel, like urination and the stool passing, is also controlled by the spinal cord. So if the lesion is in a location where these nerves get affected, patient will have the symptoms corresponding to that. Now, common things which are known are common spinal cord tumors are what we call the tumors which are outside the dura, that is the covering of the dura, covering of the spinal cord, that is called as extradural, and intradural. The intradural can be outside the spinal cord, that is intradural, extramedullary, or inside the medullary spinal cord itself, that is intramedullary tumors. The tumor again can be of different types. As you already know, the tumors are essentially two types, that is benign and malignant. Naturally, the prognosis is much better with benign tumors. The commonest benign tumors are meningiomas, schwannomas, epidermoids, and relatively slow-growing ependymomas. Many times you get metastasis in the extradural compartment or other local malignancies invading the area. With the invention of better diagnostic facilities and the surgical facilities, you are getting better and better surgical results with almost complete excision of most of the tumors in the intradural compartment. Now, apart from spinal cord tumors, we have sometimes congenital anomalies which are well known, like craniovertebral anomalies with atlantoaxial dislocation, wherein you will find that the patient has got symptoms in all four limbs. And it is their right spinal birth or sometimes very delayed presentation. Now, depending upon the congenital anomaly like atlantoaxial dislocation, Arnold-Chiari malformation, various procedures have been done. Sometimes you have to fix it to prevent the further movement. But this particular topic comes under the purview of neurosurgeons as well as the spinal surgeons. Now, there are degenerative disorders like you must have heard spondylosis with disc prolapses, either cervical or a lumbar, sciatica presentations. Now, those are the ones also being operated by the neurosurgeons as well as the spine surgeons with excellent results. Whilst talking to you, I just thought that a person would like to know what is the future of, in his particular case, after the surgery. Now, many of these benign tumors have excellent prognosis and patients do very well. And in fact, they can go to work within 3 to 4 weeks. However, the patients who are presented with certain signs where there is some neurological deficit might require a physiotherapy to start with. And if the tumor is malignant, subsequent therapy also may be added. And they require follow-up at 6-monthly or yearly intervals. I hope with this knowledge about the spinal lesions and the role of neurosurgeons in this, you will get good benefit in case you happen to see yourself or in any of your colleagues, any person who is suffering from neurological disorders due to the spinal lesions. And I can be of some help to you.